Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan, and today we're going to discuss a very important set of infectious diseases that are affecting the central nervous system that are known as the Prion diseases. So the outline for this lecture would include the pathophysiology behind the development of these Prion diseases, the epidemiology regarding the Prion diseases, and we will be moving on with the set of signs and symptoms, how do they develop, and what are the different variants of these prion diseases that we usually encounter when we carry out the outpatient department in the clinical neurology. So the structure of the prion would be discussed in detail, and we'd be discussing the different sorts of mutations even right over here. How do they occur, and what are the basic mutations that take place at the particular codonic level, and that is basically going to affect the PRP gene that is involved over here. The most typical of these prion diseases would be discussed in detail over here, and we'd be limiting our discussion to the Creutzfeldt-Jakob disease. That is the most notorious of these conditions. So how does it develop, and what is the basic epidemiology behind the Creutzfeldt-Jakob disease would be discussed in detail over here. The iatrogenic Creutzfeldt-Jakob disease, which basically encompasses the corneal transplantation as well as the EEG electrodes, durameter grafts, as well as the human growth hormones, can also cause these kind of CJD syndromes. The neuropathology and how does it look under a microscope would be discussed in detail. We'd be discussing how do you diagnose these cases of CJD over here, specifically focusing on the erythrocyte sedimentation rate as well as the leukocytosis and the pleocytosis in particular over here. The laboratory tests that are most specific for detecting this kind of a disease are the brain biopsy, FLAIR, diffusion-weighted MRIs, EEG, and CSF examination, and what positive signs you would be looking for when you're diagnosing these cases of CJD would be discussed in detail over here. How do you basically decontaminate the patients of CJD? That is discussed in detail over here. We basically encounter the sodium hydroxide at room temperature, and autoclaving is performed at 134 degrees centigrade for almost a period of 5 hours. So this decontamination is very important to stop the further infection of the other patients out there. The prevention and treatment, basically no specific treatment is entitled to these diseases, but you also provide supportive treatment, so we'll be discussing that in detail over here. So you can watch this lecture as well as a variety of other lectures on our website, sqadia.com, by subscribing to it, and you can even start your free trial right now. So that is the end. Thank you for watching sqadia.com.